My next guest represents Southwest Washington's 3rd District. Congresswoman Jaime Herrera Beutler is the co-chair and co-founder of the bipartisan Maternity Care Caucus. She's advocated for legislation to reduce maternal mortality, improve maternal and infant health, and just basically make sure that health doesn't depend on zip code, if I can just add that little editorial item. It's great to see you, Congresswoman Herrera Beutler. I want to, before we get into the maternal issues, I just want to highlight something you did that became law, which really is moving. It's called the ACE Kids Act. It allowed more than 300,000 children with medical conditions to access life-saving treatment regardless of what their zip code was. I find this a really important template to start our discussion about infant health and maternal health. Tell us what is driving you. What is your North Star in this discussion?
You know, I believe in making sure that irrespective of your income or your parents' income or the color of your skin or your gender, you deserve access to health care. How we do that has been such a subject of debate here in D.C., at least during my time here. And I decided just to take bits that I could impact and push them forward. And that's where the ACE Kids Act came from. It was a bipartisan effort. If you're on Medicaid, which Medicaid is mostly made up of children, it's about half of all Medicaid, which is the state, it's welfare, right? It's the thing that we pay as taxpayers because we don't want poor children not getting health care. That program is made up almost half of it is children. And depending on, and it's state paid. So if you're in one state and you need to access a life-saving treatment in another state, you know, there's not a children's hospital in every state, for example. You could be limited to go and access that hospital if it was in a different place. I live on the border of Oregon, right? I'm down in Southwest Washington, and there's a major children's medical center right there in Portland. But I've had constituents who've had major medical issues have had to drive up to another center. It's amazing, but it's in Seattle. It's about 2.5 hours away to access care when they could have taken a 25-minute drive across the bridge. But because of arcane Medicaid rules and I think bureaucratic, hoarding of control, up until we got that passed, they could be denied the opportunity to go to that closer place for care. And it really was a simple idea. I did learn that the bureaucracy really holds deep to its power. It took us a while to pass that, but I'm really proud of that effort.
Look, I'm really, really happy the Hill is focusing on this discussion because I think sometimes we talk about things in such generic blue label ways, and this gives us an opportunity to kind of consider what planks you need to put into the system to support people that aren't there. Two of these planks that you proposed are the Babies Act and the Moms Act. Can you tell us about them?
So the Babies Act is geared towards getting more midwives trained who can then get paid on Medicaid. So there are freestanding birth centers, like if you're not affiliated with a hospital, oftentimes Medicaid won't pay for your care there, which limits women's access to that care. And so we are putting this proposal forward that says they can still get paid for that care for prenatal, postnatal, postpartum care of those moms. And I've used birth centers. With my third daughter, I had a midwife, and it was such an awesome experience. I've also done hospital births. Those are wonderful too. But what I've learned is a lot of poor women, a lot of women of color, if they're using Medicaid, they can be limited and not be able to use midwives, which to me, I think you need to have the choice. And so this bill would open up that opportunity to make sure that even if you're on Medicaid, you still should have the right to go to a freestanding birth center if that's what's best for you and your baby.
One of the things I do, and usually I don't do this, but our sponsor today is March of Dimes. So I went in and kind of look at what sort of reports they have, and it's really interesting. And again, I use these forums in part to educate myself on what these realities are. But when you kind of look at, you've been concerned about preterm births, and so the nation as a whole ranks as C-. It's at that 10.1%. Washington State gets a B at 8.6. Seattle gets an A at 6.9%. You are the first Hispanic legislator to represent Washington State at the federal level. You have, a good understanding of what's happening across different, parts of our community based on, race, unfortunately. And so I think one of the things is, how do we get an equal distribution of health outcomes as opposed to this wobbliness and this unevenness, which I'm reading about in these reports?
Well, a big part of it with regard to maternal care had to do with passing the maternity care or the maternal, the Saving Maternal Lives Act. Gosh,
Right.
it's got an acronym, but I'm using the long title. In 2018, the bipartisan maternity care caucus, it's Lucille Roybal-Allard and I. She's a Democrat from down in California. We started this caucus a few years ago. There was nothing like it in Congress. I was shocked.
Wow.
And we started chipping away at little things, right? We worked with FDA to allow corn masa to be enriched with folic acid because we know folic acid decreases birth defects like anencephaly. It's been in white flour for 30 years, but it wasn't in corn masa, right? So we started chipping away at these, what I felt like was low-hanging fruit. And then it came to this realization that, 700 to 900 women a year in America die as a result of childbirth. And if you're a Black American woman or and it breaks down in different regions, but certainly by race, you're more likely to die as a result of childbirth. So this inequity, the fact that this is happening in 21st century America, it's just mind-boggling. So we decided to tackle that, and in 2018, that bill was signed into law, and it created maternal mortality review committees, and it allowed each state to put together a committee and to start investigating every single maternal death. And so that we could answer the question, why is this happening? Why is it so disparate? Why are we seeing health systems where they spend a ton of money on healthcare still have these gross inequities with regard to women of color? New Jersey is a great example. New Jersey had the expanded Medicaid match under Obamacare. And so you would think, comparing that to a state that didn't have that, they'd be in better shape. But we found that women of color in that area were more likely to die as a result of childbirth. So that just begs the question, why? What is happening? And so that law has been the law of the land now for about 2 years, two and a half years, and we're starting to get that data. And it's eye-opening. It's some of it is maternal mental health. Some of it is cardiovascular disease. About 33% of these deaths have to do with heart health in women. We're finding that obesity plays a role here. So it's not always just the dollars. Sometimes it's the community and what's happening and the education that happens within the community, which is why our maternity care caucus is also diving in to make sure that, newborn screenings, that there's legislation that expands that makes sure there's education with regard to stillbirths, to make sure that there's education with regard to food and nutrition. In addition, I think that the midwifery piece is really important because midwives act like coaches through a pregnancy, and oftentimes they'll come visit you in your home after you've given birth, and they can catch things and problems. So I think really to tackle this, we've had to ask the why, and we're getting that information from these maternal mortality review committees. But I do think, we're getting next steps. We know we need to expand Medicaid to a year after birth, because that's when 70% of these mortality events occur. So we're starting, it's like, we opened up this can of worms, which I was glad to do, but there's a lot to tackle here.
Well, we have more to talk about here, but I would just say when that data begins to come in, I would love for you to come back and sort of talk to us and explain, this results. Later in the show, I have Dr. Wanda Barfield, and she's with the Centers for Disease Control. She's going to be speaking, but I've just been reading. I haven't had my conversation with her yet, but one of the things she's been saying is we don't listen to women. And they know their bodies, they know what's going on. And she, I think, is concerned that we have a cultural deficit in the health system actually listening to people and these women feeling empowered to express what their concerns are. And I know that sounds like gobbledygook to many people, but to me it just strikes a chord and sounds so real. And that's not something you can legislate. How do you build in empathy? How do you build in real concern and have people feel like this healthcare system is supposed to be working for them?
That's a big nut to crack. Let's unpack that a little bit. I think one of the things that I would advise moms to be in the health system is to learn to advocate. And that literally means ask every question that comes to your mind. And if you find you're in the hands of a healthcare provider who doesn't want to answer those questions or is rude, you need to find another healthcare provider. And so it comes down to that basic level of this person is can be in charge of making decisions about your life. And if you're not comfortable, if something doesn't sit right, trust your gut. Absolutely 100%. Every time I've had conversations with husbands who've lost their wives as a result of childbirth. I've had conversations with moms who've lost their babies. And in some of these instances, there have been questions or things triggered beforehand where they just didn't ask or prod or push, and they saw a negative result. So that's the first thing. I think the second thing is, and it's hard to say because, medical personnel will tell you, if you just look at a residency training, especially if someone goes in to be a specialist, they get hit with everything. It's not like you can just build another class in there on empathy. But I do think somehow we have to figure out how to reorient the system to not just manage a condition or the clinical data, but to help come alongside the person. That's one of the things, I've had some amazing doctors, amazing OBGYNs who have been champions for me. My first daughter actually, she had a fatal condition. We found out in utero, and I found some doctors who literally stepped out of bounds to just champion her life with me. And she's an 8-year-old, happy, healthy big sister, right? She's amazing. But so she was born at 28 weeks premature. So I spent a lot of time in a NICU. So I've had doctors who've been those advocates, but I've also learned that midwives can also really come alongside you when you're having questions about what's happening with your pregnancy or how you feel afterward. A generation ago, women would have been told, that's the baby blues. You don't worry about that. That's,
right.
It's not a big deal. But today, a well-trained provider will say, well, let's talk about that. What do you really feel? What are you thinking? So I think we're moving in the right direction. Unfortunately, we're not where we should be with regard to maternity and infant health in America. And I can't find that it's a dollar issue as much as it's a system issue. And that's one of the things I'm really committed to changing.
I can really sense your passion for this, which is terrific. Look, one of the, we're all, sitting in the political world looking at things like the infrastructure bill and Build Back Better bill and what's packaged. And, I tell everybody, these are big, giant aggregates of lots of stuff, conglomerates of lots of different policy. Are there, I know that you have issues with Build Back Better Act, but are there parts of that when it comes to this topic today that you think are advanced by elements that are within that Build Back Better bill? And how would you like to see, what do you think is missing that ought to be done within this big legislation?
Well, I think that the big legislation itself was part of the problem. When I talk to people at home, they're concerned about things like the cost of milk and the cost of infant formula, which I don't know if you've ever paid for it, is not cheap, and the cost of diapers and the cost of eggs. So all those things are going up. And one of my concerns with Build Back Better was the timing of it. But there were certainly things in there that I've advocated for on Capitol Hill separately. In fact, I would argue some of the things that they've taken in recent months and put into law will benefit. Will definitely have a real benefit with regard to the health system in pieces. I do think overall that we do need to recognize if you're overspending by the amount of the entire federal budget with one bill, you got to have an economy that's going to match that, and I haven't seen that same emphasis on the economy. So that's a little bit. One of the things I think needs to change about Capitol Hill is there needs to be more bipartisan effort. That's one of the reasons our Maternity Care Caucus has been so successful. Together, Lucille Roy Bellaller and I have had things pass under Democrat and Republican presidents. Most people don't know this, but it was actually President Trump who signed into law our bill with regard to Preventing Maternal Deaths Act. So it was landmark legislation that hadn't been passed anywhere at any time, and it was needed for these maternal mortality review committees. And it was a bipartisan piece of legislation. And I think the same can be true now. I think if we're pushing big pieces of legislation, be it infrastructure or healthcare, it does need to be bipartisan. And I've challenged my own party on that. My record shows that I when I haven't felt like it was appropriate for the American people, I've challenged my own team. And I think Democrats need to do the same thing, because the American people have problems that are neither Republican or Democrat. And they'd like us to work together. And I think that's why our Maternity Care Caucus has made progress for moms and babies, and will continue to do, irrespective of who's in the White House.
No, I mean, it's really impressive. And, I'm on the editorial side here, so I can say this. I'm actually very surprised and shocked that caucus wasn't there before, just personal thanks for setting that up. We are taking questions from the audience. We've got one quick one from Hemrish. Hemrish?
Hi, my name is Hemrish Churwa. I'm from Dallas, Texas, and I am a birth worker. And I had two questions. My first question was, how can we implement more safety and just measures for moms to receive the care and support that they deserve, despite their social, their economic, and racial differences? And then the second question I had was, how can birth workers like myself receive the recognition that they deserve in the healthcare system to be able to take part of the change that is needed for maternal health?
Thank you. Great questions. You've already touched on some of it, but your thoughts, Representative?
So I'm excited, number one, that she wants to go into working in this era, knowing she's probably not going to get paid a lot, and knowing it's going to be an uphill battle to bring the change that's needed, and yet she's doing it. That's exactly the kind of person we want in the system, and that's one of the reasons that we have the Midwives for Moms Act and the Babes Act. Both would focus on getting more midwives into the system and making sure that they can get paid. But we're also really targeting women in minority populations. We want to make sure that the healthcare workers reflect their communities. So we're targeting more minority populations for training, because we know that if you're going to go into certain areas and you're going to go into people's homes, we want people to want you there and to be comfortable. And so, having women of color is an important way to make sure that women of color who are being cared for feel respected and understood. And so that's one of the things I think it's important, not to just get more workers in there, but to make sure that the workers reflect the communities that they're serving. And that's exactly what the Midwives for Moms Act would do.
What a great discussion. I really appreciate your time today. Representative Jaime Herrera Beutler of Washington's 3rd District and co-chair and co-founder of the Maternity Care Caucus. Really appreciate your time and thoughts today, and let's do this again sometime.
Sounds good. Thank you.